everybody.
Hello.
And once again, I'd like to welcome you to SaffronSACAP's voiceover. On a Wednesday, today is the 16th of December. You are all welcome. Thank you for joining us. My name is Giz Ojiako, and I am the Director for Programs for SaffronSACAP. Today, I also have my colleagues, and I'm going to ask them in my usual fashion if they would like to introduce themselves. So, Marcia, if you go first, please.
Hello, good evening. Welcome. Thanks for joining us today. My name is Marcia Eliza, and I'm the Director for Youth Engagement and Intervention.
Thank you, Marcia. And we have our boss, Yemi, if you'd like to stop shaking your head and introduce yourself, please.
Okay, hello everyone. Good evening. Wow. I don't know what tier you're in what location you're at, but we're on various tiers in the UK. Sad for us to recount that again, that we seem to be going back in time. It's a good evening. We're all happy to be alive, and we give God all that glory. Before I continue, I also want to say, as the resident DJ, that I own no rights to any songs I have played tonight. Simi has been entertaining us. And of course, I remain Yemi Ebulu Eyuntari Oluri. And it is good to have everyone on board this evening. We welcome Eric. Good to have you on board. Hi. Been a long time, but you're welcome back, your family. I don't know who the AP2 Sis Olufun carries, yes. But you're welcome. It's a new person for us. Hello.
It's not a new person. It's Olukemi. I'm using a different device.
Ah, you're disguising. You're welcome.
I'm far away from home, so
Okay.
it's a new device, a new
That's fine. We're
Good
happy
evening,
you're
everyone.
welcome. Eric, you want to drop a word
Thank
for
you.
us?
Sorry, one's got to remember to unmute. Thanks for the warm welcome, Yemi, and I'm glad to be here. Just want to say very quickly, because I got the notice quite late, so that's the mode. That's my mode. The only complaint I have, and based on the good things that SaffronSACAP that you do, I think we should be able to actually publicize the events even far much more. If I'd received the notification earlier, because I do belong to quite a lot of WhatsApp groups, which I think benefit greatly from this kind of event. So adequate notice, and then we could actually just publicize it for the benefit of a lot of people out there. Thanks.
Thank you very much. Thank you.
Thank you so much.
Noted. But please still feel free to share. We'll be appreciate everyone that comes on board. Ollie, good to see you. Way, we need to clap.
Hello, Ollie, long time.
Hi, everybody.
How are you?
I'm fine. Sorry, I'm so sorry, but I'm happy to be here.
Good. We're happy to see you. It's nice. Welcome home.
I know I've missed you all.
Missed you. And Roland, thank you for coming on. It's nice to have you. I know that Wednesday is not always a good one for you, but we appreciate your presence in the house. Without much ado, what I would ask is, whilst we are not speaking, if we mute, only because of sometimes you have unavoidable background noises. I'd also want to say welcome to our Facebook family. Thank you for signing on as you do every week and joining in with us. So yes, please feel free to share, share, because our sessions are normally very informative, and what Saffron's mantra is #TogetherWeCan, and that's why we come on every week, as a family and as a team to help each other. So without much ado, before we go into tonight's talkover, I would like to do a recap, a brief recap, and mainly for the benefit of those who possibly were not on last week, and where we talked about the effective health and social care meeting the needs of children and vulnerable families and adults in our community. It was a very interactive session. It was mind-blowing. For those of you who missed it, it's still out there. It's on our YouTube page, it's on our Facebook page. Please go and listen to it. You know, I learned a lot, and I'm sure everybody else that tuned in also did. You know, what we talked about was healthcare services. What is out there for us? You know, what do we know that is out there for us? Do we understand our rights? Do we know what we are entitled to? Do we know what we can have and what we can't have? We talked about disability, and we had an amazing, you know, lady who came on here, and that's Auntie Grace Alexander, who incidentally will be back in 2021. She will be a guest speaker for SaffronSACAP in March, where she will obviously go a lot more into what she spoke about. Ask everybody to move. Thank you so much. Thank you so much. So yeah, sorry about that. So what we learned from Auntie Grace last week was how it really feels living in our community with a child that has a disability. Now, it was raw. It was her story. It was real. So this was not, you know, Nollywood. It wasn't Hollywood. It wasn't Bollywood. It was her life, you know, and she shared it with us. And I hope that what she shared touched somebody out there to say, you know what, that's me. And as we always say here on Saffron, you know, there are many people I know who come on via Facebook, or they watch our YouTube later on, or they come on here and hide behind the camera. That's fine. But what I will say is, don't just sit behind the camera. If you need support, if you need some advice, if you need some guidance, that is why we are here. For any topic we share on Saffron, we are always going to be here to help you, to signpost you, to direct you in the right direction. Okay. So yes, last week was exciting. It was more about, you know, the services that are available to us. If you do have a child or children who have a disability, you know, how should you feel? You know, how do you feel? You know, is it the stigma that is stopping you from coming out to ask for help? Are you scared? You know, it could be the fear factor, you know. So please remember to stay tuned, and we will put it out there, as Mr. Ayula rightly said. You know, we do share, we do share quite a lot, but we will share on time, you know, especially the March one, because I think it's going to be a very, very, very informative session. Okay, so back to today's show. Once again, I'm happy when I come on here on a Wednesday, because I know that when we finish these shows, I know that somebody is going to walk away with something, because they always do, from the feedback that we get. And then that makes me know that, you know, this is it, this is working, this is what Saffron is about. We want to impact in our community. And I'm hoping, you know, we started this in March, this is now December. And I generally, from the bottom of my heart, I really hope we have made, or we are making, an impact. And like we always say, if we're not, let us know what you want to hear. And that is what today is really about. We're asking you, how can we, Saffron, as an organization, how can we impact on society? How can we help? How can we help to build, you know, a better collaborative relationships and community spirit between the African and Caribbean communities? What is it that we can do to bring ourselves together? You know, how can we build our mantra, #TogetherWeCan? That's what it's all about. #TogetherWeCan is all about building as a community, bouncing off each other, helping each other, growing each other, impacting on each other's lives. From March, we started the voiceover, as a result of COVID. We were thrown into the Zoom, and we've been rolling. We've been rolling ever since. We did used to do a Tuesdays, and we changed it to a Wednesdays. And every week we have a different topic, which is, something that is happening or not happening within our community. The idea for today is, this is not our show, this is your show. We'd like to hear from you. How can we better serve you going forward? We have how many days until 2021? I'm not good at maths. Today's the 16th, so somebody help me.
I don't know.
So today's the 16th. We've got 31 days in December, right? That's how many more days we have left of 2020. And then boom, what do? We hit 2021. How best can we serve you? What is it you want to see more happening in your community? It's your community, yeah? What is it that that is not happening, whether it's with your families, with the children, with the youth, the young people, health-wise, education, the job front? We're seeing a lot of things that are happening in our community that is not necessarily what we want to see as a people. How can we come together to stop these things from happening? We as Saffron, we want to be that bridge. We want to be that bridge, So you cross us to get to these services. You come to us. Our services are guidance, advisory, and support. And that's where we step in. So today is really, how can Saffron help to empower and build the community? We can't do it by ourselves. We do need you. But if we're not having these conversations, if we are not engaging, then we are not communicating. And all the issues that people are facing stay with them. Okay? So please, guys, this is an open mic, as you know, every week when we are on here. It's not about us, it's about you. We'd like to hear from you. If you don't want to show your face, confidentiality is very high on our list. So we respect we respect you. So if it's something you can't talk about, you can type it in the chat. Many of us know each other. You can send it to our personal WhatsApps. But if it's something generic, let's hear from you on the platform. I love to see the writings, but I also love to see people's faces, so that if I see you outside, I can put a name to the face. So yeah, I think I've heard enough of my voice now, and I'm sure you have. So I'm going to throw the floor open. It is about building our community, guys. I think 2020 has been a hard year for everybody. There is not anybody that will say it was worse for me, it was good. We've all had our ups, we've all had our downs. Some people have had ups, more ups than they've had downs. Some people are, but what we want to do is to see how, as a community, we can move into 2021. So let us know what you need, where it's lacking, where you need help. When we had the Home Office engagement team on 2 weeks ago, we had a lot of feedback. It came to light that there are quite a lot of us in the community who require help with their immigration. Please, guys, you heard the ladies. Do not wait until the last minute. They can help. That is why they are there. We had Dr. Nathan on. Dr. Nathan talked about prostate cancer. He talked about, what we should and should not be doing. I hope many of you went out to buy your vitamin D, as Dr. Nathan advised. I definitely did. I won't call the name of the shop because there are many shops, but I went to a particular shop. I bought mine, and I'm taking it because that was somebody who has been in healthcare for more than 20 years advising me, this is what you need to do in order to make yourself stay healthy. we had the ladies who came on who were cancer survivors, you know, and they told us their story. And the other lady who was into nutrition for health, and she told us her story. And I'm hoping that for each week somebody comes on, you are taking something from each of these talk shows and using it to better yourself, to better your families, your children, your communities. And whilst I'm on it, just before I go, one last thing I want to talk about, and then I can throw the floor open. As the director for programs for SaffronSACAP, one of my main jobs is to devise programs that will benefit, you know, the community. We throw these programs out and we build. And I am very, 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 very in tune with the youth. So Stepping Up is SaffronSACAP's youth program, which will be launching next year. It is about the youth. We need to do a lot more for our youth in our community, a lot more. We can all see what has happened with coronavirus. We see kids in school, out of school, in university, out of university. The young people have had it very, very rough, okay? What I'm gonna ask is keep your ears and your eyes open. If you have any of your young ones who are at home, and you think they're looking for some kind of volunteer work, or they need mentorship, feel free to send us an email. We will send or put all our contacts and our social media on the pages. I want 2021, to be the year that Saffron makes a difference in the lives of our young people within our community. Yeah, it's important. We need to stop talking about it, and we need to start doing something about it. And through Stepping Up, which is the youth program, there will be a lot of activities next year for our youth. So whether they're in university, secondary school, primary school, it doesn't matter. Watch this space, and we will be sharing a lot more in line with that initiative. Okay, so, I'm going to stop now, and I will ask, please feel free, like I said, if there are any issues, let's talk. Let's communicate, guys, because it's only when we communicate that we find solutions to any of the issues. Okay, thank you, everybody.
Could I say a few words, please?
Yeah, go ahead, Eric, go ahead.
Thanks, Giz. As shown on the script, my name is Eric Ayola. I've known Yemi for quite a long while, so no strangers. But so lovely to meet the rest of the crew as well, and to know that there are quite a lot of good people behind Saffron, holding the ship and steering it right. I think for me, I've sort of made a list here of things which I believe Saffron can actually help with and going forward. I think the first thing for me is about information. So as well know, information and knowledge is power. So one of the things that Saffron can do is to keep pushing out things out there which would empower people by just the mere facts that they are aware of it. And I've made a note as well to say, and I'm throwing the gauntlet at you guys to make Saffron a household name in 2021, okay? Within the African community, within the African Caribbean community. So much so that we know that you're there and we can come to you when we need information, advice, assistance, and so on and so forth. I'm actually quite enthused with, and it's so funny that this being, going to the tail end of 2020 is when this is coming out. And I'll give kudos to you guys for even, by merely asking that question, what can we do for you? I think that's a massive statement, sincerely, rather than just simply chucking things at your audience. You're asking, what do you want? How do you want us to engage with you? And I actually find that very impactful. So making Saffron a household name, publicity, ensuring that we that attend your events, we can drop, share news or information about your events in all the fora that we belong to. 2020 has been a bad year, but it's been a great year for social online interaction, if you get what I mean. So there's no more excuses. In the past, if you were to call me to a meeting, I don't know, in Southeast London, I live in North London today, I probably wouldn't have made it, but hey, with Zoom, I can log in. I'm still on working at the moment. So if I go offline or switch my video off, it's because I've gone back to tapping on my keyboard. So we can make good use of that, please. So please bear that in mind. And two more things. One, you mentioned is about youth empowerment, which is very important in terms of job. I've got some a young graduate who's just finished from uni, accounts and finance, is upstairs now, probably going to catch up in the kitchen when he's hungry and he wants some food. For now, he's stuck in his room. So, you know, there are quite a lot of him around looking for work and so on. But quite important as well is their mental health as well. So, you know, they might need someone to talk to, they might not want to talk to mom or dad, they might need someone to talk to. So if you have that kind of service in which, you know, we could just say, look, just pick up a phone or send an email to someone, that'd be very, very important. And lastly, in terms of the services that you offer, very essential in terms of the safeguarding aspect of things. Because yeah, sure, in our community, you know, there could be issues which, you know, people don't want to talk about, and we keep it on the low, and we don't. Well, I think it's very important that people are aware that you're there to provide that kind of support and service when such things happen. So I think that's it for me. And again, I wish you all well and greater successes in 2021 for the work you do, which I think is very, very, very important within our community. Thank you.
Thank you so much, Eric. Thank you very, very much for that. And yes, I do hope that the young man upstairs, you know, is able to find something, you know, quickly, because that's another problem with the youth. We've got a lot of them who are just floating, and you know, that's one of the main things Saffron is looking to do in terms of mentorships. You know, when they're coming out of the university now, it's going to be difficult. You know, 370,000 people were made redundant as at 2-3 days ago. Okay, so when you add all these ones coming out of the university, the numbers are just going up. But we mustn't see it as a deterrent. You know, I think what's going to have to happen through Saffron, we need to try and innovation. You know, we have to get innovative. You know, jobs don't necessarily have to be, you know, in an office block anymore. Google have closed, Twitter have closed their offices. We can get these kids empowered even within their homes. So, you know, what I'll ask you to do is what we will do at the end of this session. I will be calling out and we'll be dropping our emails. If you have any of the youth who are looking to do any kind of volunteer work, please let them link up with Saffron. You know, we are in a very blessed position because we have a lot of partners and we can signpost them rather than have our youth sitting at home. So thank you, Eric. I'm going to come to you, Oli, because I see your hand is up. Okay, there you go.
Hi. I wanted to ask because I think from experience of what I do, I don't know if this is the same in England. I'm not 100% sure, but one thing I know is the Africans. I'm always very skeptical about saying Afro-Caribbean because in Scotland it's quite a different ball game. You know, I'm not saying we don't have the same needs, but the Africans are more disadvantaged, you know, compared to every other ethnic minority. So I would speak in the context of the African community. One thing is a lot of African community that I mean, here in Scotland, I wouldn't generalize it, but a lot of African communities I know here in Scotland, through experience of working within the community and working with organizations, they tend to be consultant kind of organizations. I don't necessarily see hands-on work being done with the community. So for instance, like if they have like, maybe the government have consultations, you know, you have these organizations who would enlist themselves, they will go and do the consultations. And then maybe in some occasion, you know, they would have like a major event and get people within the community to come. And of course, you know, we know, and I don't mean it in a bad way, but you know, they know once there's food and there's drink, you know, people will turn up. But the problem, and again, I'm bringing it back to Scotland because I can speak confidently of that. What happens is when we really need to work with different ethnic minorities, you find out that the African communities are not represented. And even if they are represented, it's a face of the same people within the same organization. It doesn't necessarily trickle down to people who definitely need that help. And I'll give an example. I'm just going to make it a very general example so I don't, because I'm very conscious it's being put on Facebook in case if it's being cited. I know with the religious body, there is a lot that goes on, not necessarily religious abuse, because that's a list of, well, it's not a list of the worries, it's there, but there are like circumstances around like child protection, like, you know, just basic, maybe not even child protection, maybe just basic things like what is the role of the health visitor? A lot of our people don't know. And I have had engagement with the community, right? Of course, I can't do it as an individual because I'm doing it through work, but I've had an engagement with the community. And most of the time, even in the religious organizations, like you go to them and you're like, oh, what does the health visitor do? And, you know, they also, oh, well, you know, they come and look at our baby. They love carrying our babies. They don't understand that, you know, a health visitor doesn't just carry your baby for no reason. You know, it's an assessment, right? And, you know, you could just feel the innocence and the naivety behind their answers. And it's even funny because some who are even professionals, you know, aside, I don't know how people, well, I don't know, I suppose everybody's different, but some people, for instance, some people are nurses, right? And perhaps like in Scotland, again, I'm narrowing it down. It might be a different ballgame in England. In Scotland, for instance, most of our African sisters and brothers, they are in adult nursing. And out of curiosity, I wanted to find, I was curious to know why, you know, we had so much Blacks in Africans rather in adult nursing. And for my findings over like 3 years, you know, I just did like a raw research. And what I discovered was the access to nursing is easier. The Africans find it very easy. I mean, again, I'm limiting it to Scotland. I can't speak on a general level. Okay. The reason, from my understand, is a lot of Blacks, a lot of Africans, not Blacks, a lot of Africans who come in, who are probably well-experienced nurses in most cases. When they come in, it's easier for them to go into adult nursing. And the reason that I was given, and this is not just by 1-2 people, I'm talking of maybe like about 30-40 people. The reason for that is across the UK, obviously, if as a midwife, you are accountable for that child up until the age of 18. In Scotland, it's up until the age of 16. So there is that huge accountability. And a lot of our African sisters and brothers, they actually feel that's a burden. And I know in Scotland, I know there is subtle racism. I am not oblivious to that. It might, again, because England is quite diverse, is a different ballgame. I have seen racism. I've not witnessed it, but I have seen racism at its peak, right? Now, so because of that fear of, oh, somebody's going to report me, you know, there's that pressure. So what tends to happen is you find out that a lot of our experienced, and I'm talking of very well-experienced African nurses who are coming with wealth of knowledge, they are actually going into adult nursing and leaving midwifery. As a matter of fact, in Scotland, I would be surprised if we have up to 0.5% of African midwives. I know that would obviously be different in England, I'm guessing, because the diversity is much there. Now, the reason why I'm going deep down into all of this is, like, people who have child protection cases, a lot of times they're actually professionals themselves. But because they don't understand the robust system, or they don't know where to go for, sometimes, like some of the child protection cases I see with Africans, and I'm just putting a general thing out there because I don't want to be specific on But one of the things that is very common is the things that are always coming is always coming around our well-being indicator, which is responsible and respect. And when I say responsible and respect, so they're looking at it's almost as if there's this assumption that African parenting, I don't know whoever coined that out, but apparently African parenting is authoritarian. We don't let our children do what they want. And the reality is, how many people do you want to give that information to? And the fact is, some of our Africans as well, who's come through the radar in order to let themselves out of the system, or probably, and I don't mean this in a bad way, because I do understand, I'm not oblivious to what happens in the community. A lot of people in the quest for wanting to say things that would help them get visas. Because we can't lie, immigration is big, right? This is the elephant in the room that we don't talk about. Or even when we talk about it, we talk about it in a very subtle way, but these are the realities, because in the quest of people trying to get themselves papers or whatever it is that they try to get themselves, they make bogus statements, which unfortunately in Scotland, again, it becomes part of data. And this part of data makes up training. It also fits into policy, it fits into legislation, right? So that's that angle. Then for those people within our African community, like there was an incident that happened, I think at the middle of the COVID lockdown, whatever, it made the headline, BBC and all whatnot. Now there was a lady that died, right? Now, we had organizations who were funded. I'm not shaming or name shaming anybody, right? But I'm someone that I just like to be honest, because I work in the mainstream system. Of course, I can't come into the charity and do stuff, but I'm quite passionate about my community. Now, this lady, there was clear mental health thing going on, right? Now, there was some organizations got funding. They were giving food, and one of the criteria for that particular funding that these organizations got was to actually see the people they give food face to face, right? Unfortunately, that was not the case with that lady. Now, I'm saying the one that made his way into the newspapers. There were some that never made their way, because obviously, because of my job, I'm privy to more information, right? Now, then you also have children. Like, we have people who could not even access the food bank. They didn't know how the food bank worked. And you have organizations who are funded. And I'm not saying black organizations, I'm not saying white. I'm talking of African-led organizations who got funding, and they were working, they're apparently working, and they're taking pictures. They're posting on Facebook, they're doing videos. Now, I have problems with that, but I'm not here to rant about that. I'm just trying to articulate the things that I'm seeing. So they're actually taking pictures, and as a funder, the funders, as far as they're concerned, that's an evidence that they're reaching out to the people. So you find out that, because I know a lot of people, away, quote and unquote, that have reached out to me privately because they know me in person, and they've I've seen families like engineers, doctors, who couldn't work because of one reason or the other, because of, at the beginning of COVID, where people have to shield and, there's this assumption that because you're a doctor, you can't be poor. That's not true. On food bank, we know the people who come through the radar, and it's not the regular working class. It's, and there are people within our own community who don't even know how to request for food bank. So you're having to explain to them. And the thing is, when you tell them, or when you point them to where they should go to, they don't tell their next door neighbor. So then you have this circle where one person gets food, you think, oh, I've helped this person. But then you now realize that there are probably other people who could benefit, but they have not benefited. Like in Scotland, we have this thing called Cash for Kids. I think I sent the link to you guys at some point. So it's mainly for those under the what's it called? Those who are badly impacted by COVID. I know all of us are impacted, but some people are under the threshold. And I sent out those things to like a lot of African organizations that I know, you know, just my contacts. I was surprised. Well, you know, when we started looking at the statistics, we only had 0.1% Africans that applied, right? So there are two things. Is either the information, is either these organizations are holding on to the informations, or the informations are not getting to the right people. Because you can't tell me that we don't have poor people in the African community. And some of the information, they're basic information. Some people don't even know. When you say, oh, my word triangle, they're like, what does that mean? Some people don't even know the basics of, oh, at school, when they tell your children to draw their faces, you know, the feeling, the emotion emoji. They don't know what, they just think, oh, it's just a normal way of doing things.
Okay, right, Wura, I've heard everything you said is spot on. And obviously you're strategically, you know, positioned, you know, to know what goes on. Now, two things that the last two things you've said now is what rang out for me. Information is not getting out, and or organizations are not communicating basically within their community. Now, I know the case you're talking about. Poor lady, she died in the house. When we came online this evening, the first question I asked is, what can SaffronSACAP do for the community? Okay, if we were to go to those organizations, what do you think? You know, you're using Scotland as your, you know, as your scenario, but it could be London, it could be Nottingham, it could be anywhere. What would you say is, because this is the problem, we know the problems, these are the problems. Now, what would be the solution? Yeah. How can we connect? How can you be the bridge? Because then that would be where we would come in. How will we be the bridge between the community, the information, or the community and the organizations?
I don't know. For me, I just think the thing that is missing, because I compare the African community with the Asian community, right? Maybe I'm dancing around not answering your question. What I've seen with the Asian community, right, in Scotland is they do a lot of grassroots work, right? Yes, they have these professionals within their community who are doing who are doing the consultation, who are doing policy and reaching out to other, you know, there's some language and terms that we use as professionals. But when you're talking of grassroots, it doesn't make sense to them, right? Now, for the Asian community, one thing I know is they do a lot of, I know they do radio shows, they have events, you know, they always have something that taps into their grassroots. Like recently in Scotland, we had the child protection review, where we reviewed the whole policy around child protection, right? And they put out the consultation out to the public. You know, of course, you need to be clued up to know that, to check that. But what happened was we didn't really have Africans on board. Instead, the Asians that we had on board, they were not the regular professionals. They were actually grandparents. They were those who cannot even speak in English. Or, well, I don't mean it in a bad way, but their grassroots came in, right? Mm-hmm. And those grassroots, because you see, and I'm sure yourself and Yemi will understand where I'm coming from with this, because you see, for policymakers, we're all about, let's look at paper, let's look at evidence, let's look at research. But those grassroots, they know, you know, we can do all this lovely policy and whatever, but the grassroots knows what the problem is. And do you know that their own feedback is helping us now? Like, we're looking at the family group conference from the angle of engaging with families and rethinking the whole adoption, kinship care, whatever it is, you know, all these grammars around it. Yeah. Now, the grassroots were able to tell us, the Asian, for instance, when they came on board, they said, now, in the Asian community, I probably would never have known that. I just observed it, but I just never paid attention to it. They said in the Asian community, there's always a 3 generation in a household, right? And those 3 generations, there is always a young couple, you know, the children and then the grannies. And those grannies, they will look after the kids, just like what we used to do in Africa, right? So you find that when there are problems within their own community and they need kinship care and stuff like that, people could reach out because those children already know. It's just like our African thing where my children can call you auntie, not necessarily because we're related, but you know, you are trusted enough to care. So all I'm saying is I understand what you guys are trying to do, but I think where my own frustration always is with organizations is, where is the work for the grassroots? And I think until we're able to get into the grassroots, you know, I don't know how we're going to do it, but the grassroots is a big gap. Well, I'm speaking in Scotland. The grassroots is a big gap in Scotland. If it's having organizations that engage with the government, policy, blah, blah, we have all of that. But when you look at the level of ignorance around the system within the grassroots, it's massive.
Okay. All right, we've taken that on board. Thank you so much for that, Oli. Go ahead, Anyemi.
Do you know what? So much of what Oli has been talking about is, I know it's same conversations that Giza and I have been having into 3 a.m. in the morning. And it's, you know, one of the things you pointed out is that when we have these programs, the people, one of the reasons why we stream live on Facebook as well is to get the grassroots people, is to get everybody on board, not just the professionals. But then when you have programs like these or so many others, it's the same faces that turn up every time. And the people you're trying to reach do not want to engage. And then that's our community. And it's 2 things. Oh, I don't want them to know that this thing actually relates to me, this issue. I don't want to associate with this issue. But that issue they don't want to associate with, or we don't want to associate with, are issues that are biting us in the foot. And we're double shooting ourselves in the foot by not engaging. So when we take programs out to the grassroots, you could be standing there in the cold and we still do not get the people who want to engage. Now, one of the things that always helps is when you have government agencies that back organizations like this. It's the same thing, and it doesn't matter which continent it is in. It could be in Africa, it's the same thing. Once the government is backing you up and just putting a name to it, everybody wants to engage. You get resources and people are offering, what can we do? Because they want to be in the face of the bosses, so to speak. That's one good element in a way, if you can get that backing. But then the people that you do then want to reach, how do you reach them? And it is about, there are organizations which you are talking about, that we have these organizations who deal in policies. Yes, like Saffron, we look at policies, we look at programs, but then we also have programs that are reaching out in. It's also about this grassroots. There are organizations that are sat within the grassroots that can also reach out. And that's why we have an open policy for partnership, for collaborations, call it what you want. It's for friendship, for relationships, depending on, as we say, the organizations get more professional and then you start getting into terms, oh, it's a collaboration, it's partnership, it's a friendship. It's about reaching out and hashtag together we can. If we can come together and reach out and don't snub each other, we can go a long, long way within our communities. And it's, you know, we used to have community centers. All of these places that you could go into where you could meet people have next to nothing been eradicated. So reaching out and shouting out to people within the communities, reach out to us, reach out to all the organizations. We are going to be putting out, you know, surveys, questionnaires, information out there for you to easily reach out, their WhatsApp numbers. If we don't reach out, we're not helping each other. If I reach out, I'm helping you. You reach out, you're helping me. And that's the way it's got to work. You also spoke about, I think, hold on, 2 seconds. Yes, African midwives. I've actually written that I'm going on into the ONS website and try to find some research, some information about that, because I do know that, and I know that you're speaking about Scotland, but I do know that there is a large proportion of the African communities who work within NHS. I am not very sure about midwives. When I had my sons, and when I subsequently have been able to support quite a few people within the what you call it, birthing rooms, and I have met so many. I've met Shakiri, I've met Hausa, I've met
Maybe in England, but not in Scotland. Because
not
even
Scotland.
in visitor, we have very limited. And the reason why I knew, sorry to interrupt you. The reason why I knew about this was we had, so we're looking to do like integrated, you know how we do the integrated child protection thing?
Yes.
And obviously there was always stuff, because most of the child protection issues that's coming up, concerns rather, that is coming up within the African community or ethnic minority. Don't let me speak African. I won't speak generally now. It's lack of cultural competence. I mean, I know that cuts across, but in Scotland, I think it's quite peculiar to an extent, because for instance, like in the local authority where I work, I just found out that we're just 2 blacks. And when I say 2 blacks, I'm black, you know, compared to the, yeah. So in some local authority, you don't even have a black at all. I know that's not the case in England. I know that for a fact, right? Then with health visitors, I know one of the health visitor, a Nigerian a black health visitor. Now, I think over the time that I've been working, I've only met 5, and that's across Scotland. And one of the reasons why all of this keeps coming up is, for instance, like there were cases around FGM, where not necessarily because of FGM was done, but it was just the fact that the lead FGM nurses, because I remember going to that meeting and I said, the lead FGM nurses, the 2 of them are white. And I asked questions, how can, and this is not me being racist, right? And I asked questions, I said, how can we have 2 white ladies as, what's it called, as FGM lead nurses, when we have Africans who can, I'm not saying because they're Africans, please don't get me wrong, I'm not saying because they're Africans, they're experts.
Yes.
But I believe as an African, there is more, and even the 2 lead nurses who are the 2 FGM lead nurses, or whatever they're called, they specifically opened their mouth and said publicly, right, that they only got to know about FGM because an activist spoke to them about it. Now, in my own understanding, and I'm not saying it because I'm an African, my own understanding is just when you're talking about, when someone who has lived that experience, they have a better, it's just like Saffron. I'm sure Saffron came to be because we're all Africans. You guys got frustrated, probably you wanted to access the system. You know, when you start organization, most people, when you listen to how they start, is either, you know, they try to access something, there was a gap and they got into it, you know. Like I got into social work because of my child and because of friends, not because my child got into trouble, but I know people and I just was frustrated. And I felt, do you know what? I'm going to stop moaning. I'll get into it, right? That was how I got in there. And when my son was younger and he was in school, I know I wasn't the right face in school because my son was the only black in his school. I was the nightmare mom because I wanted to know, right? Now, back to what we're saying. So when we wanted to do that consultation around cultural competence, right? I remember sitting in that room and the only black health visitor that we had was only given 15 minutes to be there. And we're talking about something that is quite important to our community. Again, that's for the FGM, that's one. For child protection, that's another thing. On the child protection, you know how we do the child protection meetings?
Yeah.
Right? You don't have Blacks on that table. You know, surely, I mean, Scotland is multicultural. Surely there must be, you know, we must balance it out. Again, I know that's not the reality in England. I know it's quite different. But why I'm saying all of this is also within our own community, people do put fear in each other, right?
Yes.
I always believe when you come to this country, the people you meet would determine how far you go in the system. And a lot of people, I know doctors who work as security because they're terrified that if they do their PLAB exams, they would get, somebody would report them. You know what I mean? You know, people would make up stories. So because of that, the reason why I'm giving all of this example is trying to look at what can we do, because I don't know what to do.
Okay.
What can you guys, maybe like Saffron, perhaps you guys might have the answer. What can you do that would reorientate our people to begin to look at, because for the Asian community, they have social workers, they have all these professionals, and they use those people within their community to educate themselves. For me, every research has always shown that Africans are the most educated. But when you look at the system, it does not translate. You know, so I don't know what, I suppose I'm speaking from the angle of statutory, but obviously you guys are voluntary sector. I'm just wondering what can be done differently to reach these people, not even the grassroots, and also professionals within our community who we commit to working closely with you guys, you know, in reaching these people. Because once there is a problem, I mean, I know on few occasions I've called yourself and Giz at late hours, you know, for something that even looking at it, we're like, oh no, you know, there's more to this.
Yes.
But just imagine if we have caught that kind of person long before they got caught in the system. You know?
If you were on 2 weeks ago when the Home Office engagement team came on, what you said now is exactly what they said. And I think what's happening in our community is that we leave things too late. There is a fear factor. And what we do, we listen to everybody else except those in authority, those who actually have the facts, you know, not what I like to call Aesop's fables. Because I've always said, when you tell me something, you need to be an authority in what you are speaking about, okay? Or you need to have done your research so that whatever you are talking about, you can back it up. Now, you've just said something that is very salient, that we have professionals, you know, whether a doctor goes to work as a security man, in my eyes, there's nothing wrong with it. But then if the reason behind that is because he's scared because he's going to do his PLAB, then we have a problem. He must be running from something. Our community, what I think the issue here, Oli, is more of our community. We need to talk to each, we need to stop running. We're running. The Home Office said, don't see them as the enemy. You come into this country on a student's visa. When you finish your course, you should be preparing to go back because your student's visa is finished. What do? They overstay. Then you become an overstayer and then you're forever running away, okay? You come with a tourist visa. You're a tourist. You have 6 months on your visa. Come and shop. Come and do what you want to do. And then go. But when they come here and overstay, it becomes a problem. So you see all these things, and these are very educated people. So I think what it is as an organization, what we are doing, based on obviously a lot of our linking and liaising with organizations that we're bringing on here and organizations outside of Zoom, we are, for 2021, we are going to be doing workshops around a lot of these issues. We're going to be doing one-to-one hubs from our center in Gillingham. We have the our African center, which we will be using, and we also have surveys that we're putting out. And the thing is, when we put out these surveys, the idea behind the surveys is to data capture all these issues so that we can take them back and look at them and see how we can, you know, help our community. We have got to start talking. You said about the grassroots. I know so many families where you have a grandmother in the home, you have the daughter or the son, and you have the children. That's our 3 generations there. So there's no difference to the Asian community. But what we are not doing is we are not coming away from that wall. We are stuck behind a wall.
Exactly.
So
exactly.
we need to come out. Somebody just before I hand over to you, Yemi, Omolade Adebisi said, "Is it possible to get legal advice?" Omolade, if you're unable to take off your camera, that's not a problem. But when you're saying, are you able to get legal advice? I would need to know specifically on what, then we can signpost you, because that is very generic.
Yeah, I've replied her. I did say that.
You have replied.
Yes, I've given her the email addresses to get to us.
Exactly. Email us is what I would suggest. Yes, I've just seen that now. Yeah, if there is anybody on here who who feels there is an issue and they need to speak to us, please check the chat. Our email addresses have been placed there. Thank you so much, Ollie. You've given us quite a lot, and I know you keep saying specific to Scotland, but there is quite a lot of similarities between us and Scotland. So I hope that
I don't want to be quite generic because I don't know much.
It's fine. It's thrown it out there. And you hit the nail on the head. And it's sad if organizations are taking money from the government in order to help the community, and they are not helping the community. Please, we need to start naming and shaming. I'm not scared to do that. You know, because at the end of the day, we as an organization, we owe a duty of care to our community. Please, guys, if you're out there, if you're listening, please don't take this money if you're not going to use it to help the community. There is a reason this money is given to us. And we are going to be sharing at the end of today's program, Saffron, there's a lot of behind the scenes work that has gone on for Saffron in 2020. And I'm going to throw God in here because that's my leader. I am so thankful to God that he has given us this mantra. And it's a mantra, and it's not easy. It's a heavy one, but man, we are carrying it. But like I said, if we're unable to make a change, to effect change within the community, Ollie, what you said, we will speak to you off camera. I think there is a lot we can do for the people in Scotland, and I think the problem Scotland has, it is not as diverse.
No, it's not.
So there will cultural competency. We suffer from it down here in
I know cultural competence is something that cuts across, but I think I feel it's more obvious in Scotland because, we don't have that. I remember the first time I ever saw a black police. Honestly, I was like a child with a candy. I remember stopping at the Princess Street.
Yeah.
And it wasn't just me. I came out of honestly, I was so ashamed of myself after doing what I've done. Because I came out of the bus, I just jumped out of the bus, and everybody was snapping. The guy just stood and everybody was taking pictures.
Okay.
Wow.
Wow. Yeah. That's heavy.
Yes, one thing you said, and I think we keep reiterating, is that when you said it was as well, Giz, is that we don't talk. We have issues, when we have, and that's what we call safeguarding. You have issues that's small, and they start at safeguarding issues. Safeguarding doesn't necessarily mean child protection. Safeguarding just means that there is an issue that if we can address it very quickly and get support in so many ways, those issues can be quelled. They can then go back to normal family life. And the reason why the safeguarding issues, safeguarding is not a threatening word, it's a resolution word. the reason why safeguarding issues then escalate and become child protection, legal issues, is because we do not talk. It's very important that when somebody raises a safeguarding issue, they're not having a go at you. Please reach out to, there are so many organizations out there, but I will tell you that we are available for you at any time. Some of us don't sleep, can't sleep, won't sleep. But yes, we are always available for you. We have a good team of professionals. We have our coaches, we have mentors, we have clinical psychologists, that's just even the core team. We have safeguarding, we have social care, but then we have, and this is what maybe people don't know, we have a good network of professionals who are not maybe within the team, but who we also then can call on to say, this person has come with this. We have a WhatsApp group which we put together on emergency and have what we call an initial conference, where we can all just listen to you and give you advice, support, and direction. All you have to do is call, send an email, and we will reach out. But we're also reaching out, that Ollie said something, and is that we have a dynamic network of professionals, Black African professionals. I'm very proud of, very, very proud to say that we have these people. Oh, please, it's really not about money. If it was about money, we will not be here. We will not be here. It's not about money. It's about you using your skills to impact your community. It's about you using your knowledge and skills. And you don't have to be out there. Like we said, it is a network of WhatsApp professionals. No one puts things out. It doesn't go blip, blip, blip all the time. It's there for people who want to give support to your community. You don't always have to go out the big way, but that is also a big way. So really, if you're a professional out there, I'm calling on, because we need to stop complaining. We need to stop going the hey, ho. The number is out there, and a lot of you can come to my private mailbox. You can go to Gizzy's private mailbox. We have Marcia on there. We have Debbie, Deborah on there. We will put our team out again, and their Facebook pages, LinkedIn pages. There's a wealth of information. There's a wealth of professionals. Dr. Nathans came on last week. We have Dr. In Saudi Arabia. He's now our expert on sickle cell. We have the home office team, Yemisi and her team. They're readily available. We will continue to bring on professionals. Now we want professionals that want to come and just tell us about your roles. What is your role within community? Within the safeguarding child protection procedures, there is a whole section that we sat down to beef up, to talk about on roles and responsibilities. Come and tell us what you do. Come and tell us how you affect the community. This is why this platform was open. Like he said, in March, when we were supposed to have launched the SACAP, Saffron Safeguarding African Communities platform, lockdown came in 5 days before then. And so we sat down and we were gutted. But within that same month, we sat down and we said, our main aim is to reach out and bridge the gap within this community between people, the grassroots, organizations, ministries, all of that. How do we do that? And to tell you, against all odds, which is like coming out to talk, which I don't do. You see, that's why Giz talks. She's the media person. But against all odds, we are doing this, and we're asking you to just come out and support, please. Your community needs you.
Yeah.
Let's go back to the American, your community. It's not about what you can do. What is it? What the community can do for you, or what the government can do for you. It's about what you can do for your community.
Yeah.
We need to make ourselves, make each other proud. I'm very proud of all the professionals. And we're just asking you to join on the train.
Yeah. Please.
Sorry about that, ranted.
And another thing I would like to put out there is, you know, within the community, when we see, like Mr. Eric Ayula rightly said when he at the beginning of the talk show, 2020 has been difficult, but 2020 has shown us that I'm not tech savvy. You know, I became a whiz because I needed to become a whiz. Okay. There is no can't in my dictionary, right? You no longer have an excuse for not joining a meeting or a workshop that will better you, that will better your community. Now, I live on social media. You see, I'm on my LinkedIn, I'm on WhatsApp, I'm on Facebook. There are so many workshops out there which are for parenting, children, so many things. Please get off Nollywood, get off Housewives of Atlanta, wherever they are from. Get onto these workshops. Let's better ourselves so that we better our children, our families, and our community will benefit. Yeah, please. It's very important. You see, that's the only way we are going to help. We can't keep moaning about what is not working. We can't keep saying we're being marginalized. Even though we are, what do you want to do about it? Just sit there and moan? No. Let 2021 be the beginning of the Stop Moan campaign. That's what we're going to do. But we'll do it together. We want to do it with you. Yeah. So what SaffronSACAP is basically saying, and like I said at the beginning, what can we do for you? What do you want? Yeah. I've just had a few questions. Do you have legal advice for people who are involved with social services? So already in my head, I'm thinking, okay, right. Brilliant, beautiful. And we will be on there. We will be there to help. I know I have a few people who have health issues, and off Zoom, I have been able to signpost them where they need to go. So guys, we don't just come on here on a Wednesday and talk. We are action people, and we will help you. I'm going to say this again. I hope he's listening. There is somebody in our community. Your visa is expiring in January. That was the last conversation we had. You have a family. This is the 16th of December. I am begging you to please get in touch. Okay? It is better we speak to the Home Office or signpost you to the Home Office and you get the help. What you do not want is to be bundled out with your family because you have not obeyed the rules. Okay? As a community, we have to understand that we are in a society that has rules and regulations. Okay? We would not advise that you flout these rules and regulations. Therefore, anything you do not know, anything you are not sure of, please, 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 please email us, call us, pop into our Facebook page and drop your number, or possibly not your number because you want your number all over Facebook. Put your name, send a private message. We are always on call, right, to help you. But what we don't want is a case where you've come on our Zoom talks since March and you have had an issue and you don't do anything about it. All right? Okay, thank you guys. Go ahead, Lynn.
Well said, Giz. Well said. There was another question which we put out only because a lot of people were asking why there are services that people find hard to access. Yeah. And we really wanted to hear, if you can't come on, we're on Facebook on all these platforms. Please let us know which organizations, which agencies you want us to reach out to, because there is none that we can't reach out to. And let's know why you're finding it hard to engage with these, or is it that they're finding it hard to engage with our communities? Because these are gaps that we need to bridge, we need to fill. So please, like it will be in our survey, but if there is a particular one that you feel that there are issues around why you're not engaging or they're not engaging, please let us know, and we'll put that forward.
And please, once you get the survey, don't just ignore it. You know, take a couple of minutes to fill it out, because then, you know, that way Saffron gets to know you. We want to get to know you. We want to be that bridge. We want to help you, you know, within the community. You know, if there are services, my background is in health and social care. Yemi's background is in safeguarding. So, you know, it's an amazing combination. Okay, we have other professionals on the team as well. So there is nothing you would ask of that we would not be able to signpost you to or help you. And bear in mind, you'll be speaking to professionals. Stop speaking to each other and advising each other wrongly, because what then happens is, by the time you do that and make the mistake, sometimes it's gone too far for us to be able to help you. And that's what we don't want. So, you know, please reach out to us. Let's find out how we can help you, whether it's for now. And for the youth, I want to throw this back out there. You know, our young people, you know, I have a burden. I have a massive burden for the young ones, but, you know, we mustn't give up hope. They are our tomorrow. They are the future. And as a community, we need the elders in the community. We need to start doing, you know, reinforcing a lot of things, because our youth they've had a massive blow. They've had it's hit them hard. 2020 has hit them hard. We are going to be dealing with a lot of mental health. You know, parents, you know, I am not for 1 second saying, you know, lessen the grip on them. You know, respect, and, you know, our kids need to learn to respect us. But what it's a plea. Let's go easy on them. It's been a hard year. There's a lot of confusion. There's a lot of uncertainty in their young minds. You know, what they probably thought they would do 2 years ago has all gone through the window. We've got GCSEs coming up next year. We've got A levels coming up. You know, some of them don't even know. I work with a lot of them. Some of them are not sure. You understand? So let's be really, 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 what's the word now? Understanding, but let's be patient.
Listen to them, talk with them, you know, take time to couch out. I call it couch out. Couch out. I sat down with mine for 2 hours yesterday.
Yeah.
Oh.
The kids open up. They're going to talk to you. They will talk to you. They will open up. And you're going to find that they need to know that you are listening to them. So let them talk, because I find in our community, we are fond of talking at our kids, but we don't listen. Now is a time for us to just sit down, let them talk, let them pour it all out, because that alone is therapy for everything that they are going through. That's just, you know, I'm not a child psychologist. I'm just a mother. Yeah, I've got mine as well. And I'm saying it works. Take it from me. It works. And a shout out to the African community, for those of you who have children who are incarcerated. You have them. You're not talking about it, but I know you have them. I want you to know that you are not alone. We hear you. We see you. We are here for you. You need to learn to talk. You need to forget the stigma. It's nothing you have done, but you need to understand that there is a support network out there for you. Okay, Eric's got his hand up. Go ahead.
Thanks, Giz. Just a quick word to say into this, and thanks to Ollie for sharing from a Scottish perspective. The point I want to make quite quickly is, and I'm going to go back to information and publicity. I think we've spoken about maybe how come the African community are not accessing information, knowledge. there's a bit, aside from the normal, I think, reticence in our people, and the fact that sometimes actually we don't want to come out to seek help. We could be quite proud in a funny way, in which people, rather than stepping out and saying, I need help, I'm struggling here, I'm drowning, they'll rather internalize it and keep it away from even people close to them. Whereas within the community we live in, if you meet, I don't know, a white Briton today, you might know everything about him or family within 10 minutes, But our people, we keep things, we internalize it, we don't speak out. So it's a big task for organizations like yourself, knowing that you're there and you have all these things you want to give and share, but people are just not stepping forward. It can be quite frustrating, and I totally empathize with it. It's not an easy job at all. But I know that you're around the table not because, as Yemi rightly stated, not for the money, but for the fact that you want to give and the love that you have for people and wanted to do good and make positive. So please don't get tired. Rather, in terms of the pushing out the publicity. So I'm sitting there thinking there are quite a lot of ways in which, let's say, Saffron SACAP could be perhaps much more well-known. So faith communities, all students associations. I belong to Ibadan Grammar School, All Students Association UK, which is again part of a wider body called the Nigerian School Federation, which is a conglomerate, if you want, of about almost 100 all student associations in the UK. Massive, the number of people that reach out to when there's an event and something is massive. With Zoom, I attend a party almost every weekend, Friday, Saturday, there's something going on. There's a DJ Abbas show, which is on Friday. We have about 200 people on it. And he's invited quite a few people to drop in and, say a few words, and then they go and then we start partying again, old school, Nigeria hip hop, whatever. I love dancing, so I'm always there. But it's a very, very good way to actually showcase events amongst our people. So old school, faith groups, social events, you can tap into that. I could actually get Saffron Safeguarding invited to DJ Abbas, for example. Just drop in 5 minutes, just talk. They'll say, oh, okay, good. How do we find you? Give them your website, and there you go. Who knows? Nigerian School Federation is another one. I could get contacts into that as well in second. Look, I just want to come in. You want to come in to share an event or something with them, and so on and so forth. So please don't get tired, get fired up, and because you're going to make even a greater impact in 2021. Thank you.
Thank you so much.
Yeah, we weren't definitely not getting tired. If anything, we are so fired up for 2021. It's unbelievable. So yeah, we're definitely not getting tired. Definitely not getting tired. I just want to quickly acknowledge that Mr. Femi Babarinde, am I correct in saying you were on here a few months ago from Nigeria? Please correct me. I think so. Femi, are you there? All right. Let's see if he's.
I'm here, yeah.
Yes. Yeah. Okay. How are you?
I'm fine, thanks. Yeah.
Brilliant. And am I right in saying are you streaming from Nigeria?
Unfortunately not.
Okay.
I'm stuck in
Wishful
London.
thinking is.
Okay.
Yeah.
Probably another Femi, but that's fine. It's nice to have you on. Good evening.
All right, yeah, thanks.
Okay. Good evening. Okay. So yes, Yemi, if you just want to take over from here, and then towards the end, I can give them a shout out as to how our 2021 is going to look like.
Oh, go with the 2021 first.
Okay.
I just try and reconnect us.
Okay, awesome. Right. So without much ado, like I did say, today is the 16th, so we have a few more days left. And the whole idea today, obviously, was to hear from everybody and hear what it is, you guys want us to do for you as a community. We're already getting a lot of I'm getting a lot of calls on my phone here and inboxes, which is good. That's what we want, because that's what we're here to do. And as Eric said, we shouldn't get tired. And believe you me, if anything, you know, this fires us up more than anything. You know, I don't think we've ever missed a Zoom apart from when we went on the NSARS movement. But that was it. We've been on every week, and that's what, and it's going to continue, guys. It's going to continue. So for 2021, what is the focus? The focus is you guys. It's the community. We want to bridge the gap. We want to work together. We want to come together and make a change within our community. Just a few things that I'm going to put out there, which will be happening. What we're going to do for this weekend, we will be sharing our a leaflet of all our programs is going to come out hopefully by this weekend. And as Eric rightly said, you know, information. Wura said it. Information. We try to make sure that we get it out into the community. We're going to do it a lot more come 2021 because we've got so much going on. But we need you guys to not just read and walk past. We need you to be actively engaging with us. So we're going to be there'll be workshops, there will be one-to-one hubs, you know, we'll have parenting classes every Saturday morning, you know. There's going to be a lot happening, but it's for you. So if you are not engaging, it doesn't make sense us doing it. We're not doing it for us, we're doing it for you. These are just a few of the things that we're going to be doing, plus the youth mentorship program through the Youth Stepping Up angle or the arm of SaffronSACAP that I mentioned. There'll be youth mentorship, career guidance. You know, a lot of our young people are transiting to universities, but they don't actually know what they want to do. I know when I took my school certificate at that stage, I already knew my career path. I already knew where I was heading, you know. So this is the thing, this as a community, this is what we should be doing for our young people. And we just want to be Saffron, we want to be that listening ear, you know. There are some homes, unfortunately, and it's a sad fact, but there are some homes that just will not listen to these kids, don't have the time for the kids, and there are other issues. There could be mental health, there could be sickness. COVID has brought a lot of problems into homes, okay? And we mustn't take that away from it. So we want to be the buffer. We can never be the parent, but we can be the buffer. So we want to be that ear that is there for these young people, all right? And that's what we're going to be doing under the youth mentorship initiative that we are launching in 2021. Yemi is working on a report, putting out training on cultural competency. That's our guru there. I would suggest that any training Yemi puts out, attend. Please attend. I've known Yemi 22 years now, and what I learned, or what I learned under her tutelage, is mind-blowing. You know, I've always said, whenever you want to learn something, learn from the best, become the best photocopier, okay? Because if you learn from the best and you just copy, then make it your own, you're on a win-win. And that's the only way. If we want to build our community, make our community very strong, we need to start listening to the people who are in the right places and not the wrong places. So please watch out for the workshop. We will also be running workshops within the faith organizations. We have a committee within our faith organizations where we will be focusing and highlighting on safeguarding within faith organizations. It's very important that we understand the importance of safeguarding within these entities. Very, very important. Within our community, there is a lot of lapses, you know, and there's a lot of carelessness. I like to call it carelessness. And there was a case in Elephant and Castle within a faith organization of a minor. I don't know how this minor got hold of this liquid in the toilet, but they did. They drank it and they passed away. Okay, unacceptable. Somebody will be held accountable. So what we want to do as an organization is not about naming and shaming. It's more about, we want to work with you because we are part of the community. Yeah, we are part of this community. We're not separate, okay? But we don't want to come in and be the sergeant major, you know, good cop, bad cop. That is not what it's about. We want to engage with you. We want to work with you. We want to stand side by side. Get your policies right. Yeah, get everything that you need from a legal point of view to run your organization safe, especially because you have young people on site. SaffronSACAP will help you get there. Please don't hide around we've got all our policies, because if we come in and do a mock inspection and see that that is not the case, then, you know, it wouldn't be nice. Yeah, let's build. We need you. We need the faith. During COVID, it's the faith that has kept most of us sane. So you guys are a vital, vital, vital part of our community, but we do have to get it right. So please watch out for the faith organization workshops that we're going to be doing. We'll be doing some online workshops as well, which we will run from. Some of them will be run on a Saturday from our center in Kent, because that's where we're based in Gillingham. And we will run some of them live on Saturdays. We're going to COVID guidelines, you know, we're going to work around the COVID guidelines, but we will also be doing one-to-one hubs for parents and young people. And we'll be doing our parenting classes. But obviously, everything we are doing will be in line with the government guidelines. So please just continue to look at all the information we're going to be putting out there. And that will be your guide to our working plan for 2021. Okay. All right, Yemi. I think I covered everything.
Yes, I think
Awesome.
you did. Marcia is here and she has something to say. Our coach, mentor, I don't know, this woman is loaded. I've worked with her for years at Child Protection Unit, and she also works on the NHS now. The woman is she's an octopus. Go girl.
Go ahead, Marcia.
Hi, sorry, I had to jump up because I was on a coaching call where I was being coached. So that's where I was. Yes, I'm a certified life coach. I'm also a mentor. I'm also an NLP practitioner. So yes, and so I'm here. I am passionate about young people, but I also coach professionals. My niche at the moment, I'm aiming at the moment to try and work with social workers and nurses to coach them, because, you know, generally you find, okay, you do your social work training or you do your nursing training, and any other training you get after that is just geared just towards the job. There's nothing holistic about the training that the organization offers. And what I would like to do is for nurses and social workers in particular is offer some sort of life coaching that's more holistic, that helps them to work better in their career path, not necessarily the day job. And my other and great passion is the young people. So the young people out there who need some guidance, who don't know where they want to, what they want to do. Do I go to uni? Do I drop out of uni? Do I stay in education? We want to be able to help them, to guide them, to nurture them, you know, help them to set goals, help them to understand what goals is like. Also, what we can run as well is some financial sessions in them, understanding money. So I also am part of this organization called Jenny Star, where we'll have someone on board, I think it's in February,
yes,
who will come in and talk about
February.
financial education, because lots of families and lots of people don't understand. I mean, it was eye-opener for me actually doing this training to see how there's the way we can save money. And, you know, and we just, like, for example, we'll have 3 or 4 different insurances being paid out. With no common sense whatsoever, we can combine those into one. We can save money. It's about also paying off your mortgage in a different way, you know, because the banks don't tell us a lot of things. The banks don't tell us. And, you know, there's a way you can actually pay off your mortgage quicker by following a certain method, where the banks won't tell you about that, you know. And going back to the young people in school, they don't really teach them about finances. They don't understand. I have a 19-year-old and I'm constantly trying to get it into his head, you know. So I try to say to him, if you get £50, save 10, spend 10, invest 10, you know, but they don't understand. As far as they're concerned, they get £50, they're just going to spend it. So let's try and educate our community, because it's very important, you know, very, very important, because they just don't know, and no one else will tell them, because the banks just want to make money. They're not going to tell them you can save money in different ways. The insurance companies, they just want to make money. They're not going to tell them how they can save money. So coaching, mentoring, financial education, bring on 2021, Saffron's on it.
Yes, bring it on.
Thank you, Marcia. We're definitely on it. Yes, Ollie, go ahead. Unmute yourself, Ollie. Do you have your hand up?
And she muted herself again. She unmuted and then muted.
Sorry.
Okay.
Yeah.
Sorry. I have a question. I love all the programs you guys are wanting to do. It's like an answered prayer for me, right? Particularly the one on finance. Marcia, I can tell you outrightly, I learned a lot this year. I never knew I could save so much, right? And well, I've learned.
We're coming
Now,
to dinner, Ollie.
coaching, I don't even have a penny on me anyway. I'll
Thanks
tell
so
you all about
much.
it.
We're coming to dinner.
We'll talk about it behind the scene.
Yes.
Now, for the mortgage and stuff, that's very important. For your, please, for your finance training, would you guys please let me know? I know I'm always busy, but if you just try and
Don't worry.
pull me around.
February,
Now,
the whole of February, Ollie, is financial February. So we have 4 weeks.
I will try. I think I've got a
Different
couple
streams
of
of
things I will try.
income. My
Yeah.
kids are now already on level. How many streams are we on now? Three.
Three, yeah.
Yeah. Now, I also wanted to say something about the, what's it called? The one on the life coaching. I really think it's very good to do coaching, particularly for social work and, you know, all of us and whatever. But when you talked about you having a 19-year-old and, you know, like sometimes they don't know what they're looking to do, blah, blah, blah. I was once in that shoes, right? But I think when we get to that stage, I will share my experience, because I'm quite passionate about it, because I was about to make a mistake with my child. And I was lucky, you know, to have the right people around me, right? I suppose if I know what I know now, I would have done things differently. But I was just lucky to just have the right people. And I know that it's not everybody who has the kind of network that I have, you know, that was able to guide me. Now, for your program that you're wanting to do, I didn't really hear you guys talk about immigration. I don't know what it is, but one thing I would say is, for families, most of these families that are coming on the radar, or some of the families who are burying their head in the sand, a lot of them, there is immigration undertone under their problems.
Ollie, you missed it.
You missed it, Ollie.
Ollie, you missed it.
We had a whole
awesome session.
No. I mean the program for, Giz was talking about program for next year.
Yeah, we've already done the home. We've done the home.
We had the home office.
We had them on the home office.
Yeah, I know you do. You know, when you were talking about your program for next year, I was wondering if you would have more sessions on immigration. Now, the reason why I'm saying that, you know, you were talking about like people who come on student visa, people who come on, I mean, I was so naive. It was just recently that I got to know that when students come, a lot of them go to specific nightclubs because that's where they meet, well, off camera, you know what I mean?
Yeah.
So I didn't know that. I was so oblivious to it, right? And then also with the visiting visa, you know, there's a lot of things that I didn't really know. And I think also for the religious bodies, a lot of times as well, give it to the leaders, a lot of times the leaders themselves don't know better. So they kind of mislead their own people. And I think, I don't know the kind of work that we done with that, but immigration is a big thing within our community where people would guide. Some people have overstayed because of wrong advice. And I'm sure Home Office has talked about that. But I know I came across Yemisi Jackie, one of the jobs I was doing. That was when I first came across her. And a lot of people, some people have overstayed, some families, they don't even know. Yes, they don't have recourse to public fund, but they don't know that they can reach out, that there are other helps out there. And COVID was a very good example where I was surprised that a lot of families, because they didn't have recourse to public fund, they didn't realize that they could even access food bank. They didn't know. Some didn't even have, like warm clothing, but they thought if we go and ask for these things, it's going to impact on our visa. Some people don't even know that, they can apply for like the heating allowance, and that has nothing to do with their visa, so long as they can just, because there are different organizations that can help fund. So again, I think because of the no recourse to public fund and stuff, a lot of people don't know what is accessible to them. Yeah.
That's right. What you just said, Ollie, like I said, I think a lot of people think our Zooms are just, we come on a Wednesday, but what we do behind the scenes is so much. And one of the things is next year, we are actually in talks now with the Home Office based on the program we did with them a couple of weeks ago. And what we would be looking to do is one-to-one hubs, and it's all around immigration, all around the issues you're talking about, the overstayers, the people who don't understand what they are legally allowed to have or not have. And then secondly, food banks have come up a lot in tonight's show. And one thing, it was 2 nights ago, Yemi, as she does, she likes to wake me up at 3 o'clock in the morning anyway. So she's woken me up, and it's funny because as she was thinking, I was thinking. Now, I'm privileged to have worked with some of the food banks in my local area. Let's be real here. If I, I'm not going to say thank God, because nobody knows tomorrow. I might need a food bank. You never know what's up ahead. But if I was to go to a food bank, it would be tins of beans and da-da-da-da and da-da-da-da. And I will tell you now, there's a lot of people in our community who the food banks that are out there do not cater to the African and the Caribbean community. So Saffron, what we will be doing, and this is part of the things that we were going to put out over the weekend for the community, we will be doing a bi-monthly food bank. And that is just for the African and the Caribbean community. We have 3 boroughs at the moment that we will pilot, but we are looking to extend. I am in talks now with one of the councillors for one of the boroughs, and it's going to be African food. So we're talking of rice, we're talking of gari, we're talking of kenke, we're talking of rice and peas for the Caribbean community, plantains. It's got to be the food that. There's no point then going to a food bank to get peas when it's not what they eat. Yeah. It's just the same thing. I'm in my background, I'm in health and social care. And some of my clients, Meals on Wheels. Okay, Meals on Wheels. Okay, cool. They've got to eat. But are you sending Meals on Wheels, mash and peas to, Mr. Njoko or Mr. Olabode that will not eat it? Yeah. No. Okay, so you see, this is what we're talking about, cultural competency. We're talking about, the powers that be need to understand that the African and the Caribbean community have a culture, we have a food. When you look at the Jewish community, it's all kosher. Anything that is not kosher doesn't go into that community. Therefore, when I'm aged and I'm, going to possibly have Meals on Wheels, because I'm guessing the kids will be too busy to cook for me. When I'm gonna have my Meals on Wheels, I don't want you to bring me potato and mushy peas, because it's not what I grew up with, it's not what I'm used to. And there is nothing wrong with peas and mashed potato. That is not our food.
That's not our food,
There you go. So just throwing it out there, bi-monthly, every 2 months, and we might even reduce it. But for now, what we will be doing is rotating amongst these 3 boroughs, where we'll be providing an African and Caribbean food bank. And we've been privileged because, people do come to us and say, can we do this? And we go to people and say, look at this idea. And we're going to link with some of the biggest food warehouses in London who will be supplying. So that, hopefully, I wish we could have, helped you out there in Scotland, but you know what? It might be something you want to put into the African community out there. Maybe somebody can take it up there and run with it. Yeah. So yeah, that's just
mine's more of conflict of interest. I can't be seen.
No, you can't. Not you as a person. Not personally. Not you personally. What I'm saying is the organizations out there. This might be something they want to think about doing.
No, I think what it is. I know some organizations that do African food, but I think one of the concerns for some of the communities they were giving it to was they were taking their pictures and put it on Facebook.
Yeah.
For the African, I could see where they're coming from, putting those pictures on Facebook and Twitter and whatever they were doing. But for the African culture, that does not, they're evidencing it to their funders. But unfortunately, there were a lot of people that would not access it because to go on.
Confidentiality is key.
Apart from that, I think it's a thing of shame, because during COVID, a lot of families, it's not natural for our fathers and mothers to go ask for food.
Yeah.
So most of these people because I remember speaking to one of the organizations, because I actually saw a man and his children, and the man was literally covering his face.
Well, we've got to respect.
But they said, they have to evidence to their funders, which I can understand. But unfortunately, like I said to the guys, I said, you should have let your funders know. And this is where cultural competence come to play.
Into it. Yeah.
Yeah.
But
I mean, for a white, it might be okay, but for a black,
But Ollie, they can record these things and not put it out on social media.
I don't have control over their
protection. When we have our JRs, we have evidence that we need to put out. It doesn't have to be out there. It's something you can document within your files and put out.
Me, I don't have control over what they do. Me, I just, because when I do referral, people call me and then I'm like, oh, this is what they give in the mainstream food bank. Why don't you go to these? Because I know that there are organizations that do the African food. And I'm like, why don't you go there? And they're like, oh, I can't go because they would video me. And I don't, and because of the nature of my job, I can't be seen to influence what they do. So it's up to them. I mean, it's not right.
Yeah.
It's not right, but at the end of the day, I can't control, because then it might be, oh, we didn't evidence it because Wura said, and then it's the case of who's Wura, and
This is one of the reasons why we actually put out that what are these organizations that are hard to access, and this is one of the reasons, because people don't want to be seen to be accessing these stigma or what do we call it, packaging and all of that, and those are the reasons. But also these organizations, and when we're doing this, it's not out there for everyone. You might put the picture of the van out that you were at such and such place, and that's fine. But whatever evidence your funders need can be evidenced, I would call privately. Yes. You can have it in a report for them. You can have it in a CD for them, and they can watch that without putting it on social media.
Yeah.
Now, one thing I would say is, you know what you're saying and you understand the context because of the nature of, you're coming from a very strong career background where you've worked in the system and you understand the repercussion. Now, that is not the reality for most people who set up organizations.
Well, it then has to be incorporated.
I'm not giving an excuse, but that's the reality,
Yeah, that's why we have to shout out to funders, to people who put this funding out, and if you are applying to it, then it's good for you to then put out that these are the reasons why we shouldn't be doing this. And the more we talk about it, the more we campaign, not against it, but towards it. We campaign towards it, then we will get better results. And then when you are putting up programs like this, you need to let people know that this is what we call consent within our lines of work. We will be recording this. We will not be showing it on social media. However, it is for the funders who will then ensure that you have this program next year.
Exactly.
So it's you support us, we support you,
Yeah.
but we won't put you out. One of the major things that I was told of when we were, we've been in Nigeria for 5, 6 years now, was the fact that there's some, I know some people call me Omo Council, but it's all right. You're laughing, it's true. Because I have a council, social work council, mentality that we just come out for results, to support, to get results, to make sure that we're impacting, we're doing the right thing. And when we started out, we did not put out all the work that we were doing on the ground out on social media. And even still then, many children that we took off the streets, we are not able to put them out. I can't. There is no way I can. We're still supporting these families now out of our own pockets. But they want you to put a picture out, it's a story, and then no, it's not going to happen. Sorry. If you like, donate. If you like, don't donate. God will donate. But we're not putting these children out. They will grow up tomorrow. It's not nice. It's not nice to put them out. There is one African prime minister, I don't know, president, and you can always relate him back to the picture where he was a vulnerable child on the streets looking ragged. He is a president now. And then look at that. If to these children you put them, we have orphanages we've gone to support. We can't put them out. I watch them on my phone and I'm laughing and I'm happy that yes, we're able to do this. We can't put them out. Organizations need to start, and it's the funders as well. But it's also because our society, our continent, if you don't evidence, you do not see where the money is going to. Evidence it on a CD and
find it. I think
you're right. Sorry, I think, Yemi, when you do your report, one thing I can do, because I know there's cultural competence quite a big thing now within the sector, within the government and the sector. If you don't mind, when you put out when you do your report, do you mind if I share it because I would like to share it with the, I was telling you about what we did within a consultation just now.
Yeah.
And I think that would go a long way if I share it, and it could, who knows, it could be a point of reference. If you kind of do it in a way, because the way most people write their report, like most African-led organizations, they don't write the report in a way that it can be referenced academically.
Yeah.
So if you make it a little bit of academic reference, because I would want,
it can be peer reviewed.
Yes, it can be. It can even be. Even the government can look at it. So I'm quite happy to share it in the whatever that I belong to. I'm, like share it there, and I'm very sure. And I know the people in that in there that I know there are people who can make things happen. Within whatever. So it would be nice to share it, because I remember the first time I contacted you, I said we're looking for an African-led organizations that can put sense into the reality.
Yes.
So even if we put the report, if I put it out there, it's coming up in a very timely time where we need it. And also, I know there's few consultations coming up.
Yes.
Perhaps if this report comes, it's something I can easily point you to.
Awesome.
And you can do it from that angle, because we need to have this conversation. It doesn't matter what part of the country we're having it from. We just need to have it. And I think once Saffron gets their voice heard in one, devolved government,
yes,
I think a lot can be done. Exactly. Then also I was wondering, have you guys tried to link up with, what's it called? Barnardos and what do they call them?
NSPCC?
Whatever they're called.
Yes, we're already discussing.
Already linked with them.
Many other
yeah,
things.
because they have a funding around, I don't know. Please don't, no, I'll say it offline. No.
Yes, let's talk.
Okay, that's fine. Just let us, we
can tell you more.
Yeah, and we'll tell you more. But yeah, that what you said about, the funders and getting the pictures. The downside is the people who need this service are now running away from the service as a result. So it's counterproductive. So yeah, we need to have the conversation. Take your pictures, get your evidence. But if it's stopping the initiative reaching the right source, as far as I'm concerned, it's useless. Facebook doesn't need to see that. Your funders need to see it. It then becomes sensationalism. It's no longer what you're doing for the community. It's now becoming me, and that is not what organizations should be about. There's so much that Saffron does that you don't see the pictures, but you probably see the impact within the community, and that's what it should be about, not how many likes and dislikes you can get on social media. So thank you so much for that, Wura. It's been amazing having you on as always. You know, very informative. But like I said, we need to catch up, and we'll catch up off camera. Yes, it's 2 minutes to 8, guys. So yeah, it's been amazing. Thank you so much to everybody that has come on. Eric, your input today has been awesome. Thank you, thank you, thank you. Hope that you'll join us soon. Omolade,
Thank you very much. Thanks.
You're welcome. You're welcome, Eric. Omolade, I heard and saw everything you wrote in the chat. So yes, we will catch up after the Zoom. Femi, thank you for joining. HMGSF, I have no idea what that means, but it's nice to have you on as well. I hope you've been able to gain some valuable information. Also, Dr. Olayinka Bello. How are you, Doc? Good evening, sir. You've been quiet. Nice to see you on here. I hope everything is well with you. Thank you so much. And to our
Thank you. Good evening.
Good evening, Dr. Bello. Thank you for coming.
Good evening. How are you? Well done.
Thank you. You've been quiet, but it's nice to have you back.
It's a pleasure. Thank you.
Okay.
Well done.
Thank you so much. And also, I know. Also, our Facebook Live family, thank you so much for coming on today. I know Auntie Grace Alexander, she hailed us from Facebook. So good evening, Auntie Grace, and we're looking forward to having you on in March 2021 to talk about, you know, the disabilities within the families and within the home. Yes, we do have some people are joining as we're about to round up.
Yeah, but I think she will want to say something, so let's see. Or they would.
Okay, we'll let her join. Before she joins,
Sorry, guys, I'll speak to you guys later.
Okay, Wura, that's fine.
Yeah, right.
Okay, that's fine. Just to let you all know, next week, Wednesday, will be Saffron's Christmas. We're going to have a Christmas party. We're going to have a Zoom Christmas party. Yeah, it's just going to be, you know, to round up the end of the year, to come and say thank you, really. You know, thank you for having us. You know, thank you for allowing us into your rooms, you know, your homes, your private space. Yeah, thank you for engaging. And we hope that you would continue to engage with us in 2021. 2020 wasn't amazing, but you know, in every negative, I always say, look for the positives. Yeah, because what it does, it just makes us stronger, you know. And I think that's what's happened with Saffron, especially. We've just gone from strength to strength, but we couldn't have done it without you guys, you know. So thank you one and all who have come on. And we do hope that you will be back with us in 2021. So next week, Wednesday, get your party shoes and your party hats on. And we're going to be, we will be looking to give away some gifts, basically. So if there is anything, you know, you want to donate, you know, feel free to message myself, Yemi, or Marcia, any one of the directors. That would be amazing. It's not obligatory, it's totally mandatory, you know, but it's just to get into the Christmas spirit. You know, let's try and round up 2020 on a high, and that will take us straight into 2021. Good evening, Yemisi Jenkins, MBE. We have her in the house. Can you hear us, Yemisi? The only problem we have with Zoom is sometimes. Hi, Yemisi, can you hear us? Hello.
That's a shame.
Yeah, I know. It's technology, isn't it? It's technology. Thank you, Omalade. Thank you so much. Omalade said, thank you for this meeting. You're doing a great job. I'm happy I came across this well detailed. God bless you. Yeah, we're always, willing, ready. We would always be out here to give guidance, advice, and support, because that's just what we do. So, yeah. Hi, Missy. Can you hear us?
Hi.
Hi, good evening.
Good evening. Sorry, I'm just joining you. It's been a long, busy day.
I know. We were just telling everybody about our Christmas party next week, Wednesday. Hope you'll be here.
When? Monday?
Wednesday.
When? Next week. Oh, okay.
Yeah. So we're actually just rounding up the session, to be honest. But we just wanted to say thank you to everybody that has supported us from March till date. We can't believe we've got this far, but we have. We will be releasing all our programs over the weekend. So just for you to have a bit of a catch up. And I don't know if there's anything you wanted to say in view of today's program, which is what can Saffron do for the community? What is it you would like, what would you want to see more of Saffron doing for the community for 2021?
Well, in my own opinion, I think there's just Saffron should carry on doing what it's doing, but try and reach out to the wider community through maybe faith communities or organizations, but we need to spread the word more, and even across, to Nigeria. So that would be my own advice going forward. It's going to be tough, but it's got to be done.
Yeah, we'll do it.
And with commitment, it can be achieved.
Definitely. Awesome. Thank you so much. And we're definitely taking that on board. Yeah. Nigeria is, that's the mother, isn't it? SDGF, which is our, I like to call it the mother because that's where it all started.
Oh, yeah.
So, we have a Caribbean island as well. Marcia, please educate us.
Yes. Marcia, unmute yourself. Can you unmute?
Just try it. Okay.
Yeah, go ahead.
No, I was distracted. I had a call coming in, so I didn't hear what you said.
No, we said, because Yemisi Jenkins MBE is on, and we were talking about spreading to a wider community. And Yemisi said, obviously, Nigeria, we do have SDGF out there, which is Saffron Development Global Foundation. But we were also talking about, obviously, taking Saffron to the Caribbean.
Oh, absolutely.
So it is.
We're global. We're gonna be global.
Did you just tell us some of the islands, some of the places that
St. Vincent, Barbados, Grenada, Dominica, St. Kitts, St. Lucia.
Oh, we're going.
Got loads. We're going wide. We're going global.
We will, because that's the community. So we do need to.
Because safeguarding on the islands. I mean, when I was growing up, I don't think we had. I can't think of a social worker. I just can't ever remember such a thing as a social worker when I was growing up. I know we have it now, but it's not as established.
Yeah.
You might have a couple of social workers on an island, but it's not as established.
Sure.
And we still have the issues where people just ignorant in some areas. So yes, definitely. Definitely.
Okay. Awesome. And obviously we want to reach out to, our non-Nigerian African community. So we've got the Somalian community, the Ugandan community, Malawi, Ghanaian, yes, our heritage is Nigeria, but when I talk about, Africa, I'm not just referring to the Nigerians. So, for the non-Nigerian community within the United Kingdom, please, Saffron is also here for you. Yeah. So we're talking, like I said, it's not just the Nigerian community, the Somalians, the Ghanaians, Zimbabweans, the Kenyans. Yeah. Please reach out. Let us come into your communities, where we can help, where we can effectuate, where we can create an impact within your communities, please let us do so. Together, hashtag together we can. That's our initiative, and we you know, it's a mantra. We believe so much in coming together as a community, and let Saffron be that bridge. Yeah. So on that note, I am going to say thank you once again to everybody who has joined us again this evening. It's been very interactive. It's been very informative. For the youth out there, if there's anybody that would like to volunteer, we have an open door policy for volunteers. I think what we would do is to put a form. We're going to share a form on which platform would we do that? Possibly the youth. Sorry?
All the platforms.
Put it on all, but I'm going to tell you now, no youth is on Facebook because mums and dads are on Facebook. But we'll still share it. We'll put it on the WhatsApp. We'll put it on
It'll be Instagram.
Instagram is where you'll get them.
Share to their youth, you know.
We'll share to all of the platforms. And I know mums and dads, please encourage your young ones. If they're at home, you know, if they're just finished from uni, they're on a break, you know, volunteering doesn't mean you're out every day, but it just means that we will engage with them and see how, where, and what we can do for them. That's one of the very strong things that we will be doing in 2021. So we will be sharing our volunteer forms on our platforms. Okay, right, without much ado, I don't know if you guys have had your dinner. It's a bit late, but so I'm going to release everybody now. I'm going to say have a beautiful evening. Thank you all so much for joining, and hope to see you next week, Wednesday, for our Christmas party. Have a good evening. Good night, everybody.
Good night,
Bye.
everyone. Thank you. Bye.
Good night. Bye, ladies. Bye, everyone.
Bye, Eric.
Bye.
Bye.
Yeah.
Bye, everyone.
Bye.